Good evening, and thank you for joining us for this virtual awareness Zoom meeting presented by Ms. Monique Mitchell on behalf of Beacon. My name is Cecilia Thompson, Member Services Manager at BARP. Before we begin, we wish to discuss some housekeeping matters. This meeting is being recorded and will be shared on our BARP's YouTube channel. If you do not wish to be in this video on the channel, we ask that you turn your cameras off now. All participants will be muted upon entry. The meeting will only be open to questions during the question and answer segment. During that time, if you have a question, you can either place your questions in the chat or use the raise hand reaction located next to the chat button in your Zoom app or browser. With that being said, I would like to introduce our presenter, Ms. Monique Mitchell from Beacon.
Celia, and good afternoon, everyone. So today's session will really be used as a refresher, more so just to go over your benefit limits and some key things that you should bear in mind where claims are concerned. So I'm going to share my screen with you. So Alicia, you could tell me when you're seeing it. Either Alicia or Letitia.
Yes, you can go ahead.
Okay, perfect. Right. So on your screen here is our mission, vision, and core value statements. I won't get too much into this because these three statements could be found on our company's website. What I do want to say here is that the three statements does form part of our strategic compass, which really guides how we act, think, and speak on a regular basis. Now, at the core of all of what we do is our slogan, insurance is a promise to pay, and at Beacon, we keep our promises. Because we've been in the industry for quite some time, we're able to have a nice geographic spread throughout Trinidad and Tobago, and of course Barbados, but also the other Eastern Caribbean islands. So I'll jump straight into your benefit plan. Now on the screen, you're gonna see the two divisions, more so the 40 to 49 year division, which is in the middle column. And on the right hand side, that column will be all insureds that are 50 and over. Now to begin with, you have your major medical maximums for both divisions on the screen. What I'd like to stress here, however, is that every year there's an annual maximum for each category. So for those of you that fall within the age bands 40 to 49 and 50 to 59, please bear in mind that there's an annual maximum of 175,000 to be used. For those insureds that fall within the age categories 60 to 65, please bear in mind that your annual maximum is 125,000. And for those of you who are ages 66 and over, your annual maximum is 100,000. Now, the benefit period on the plan is lifetime, which means that your major medical maximum can carry you until death, or you can utilize the maximum before death, but bear in mind that it's not replenished. So as you use throughout the lifespan of the policy, it's drawn down from your overall maximum limits. Now I'll talk a little bit about deductibles because I know this might be a tad bit tricky for some persons. Your deductible is your out-of-pocket expense that is applied to the very first claim you submit every calendar year. Now, for those of you who aren't familiar with the calendar year, it usually runs from January to December. So if I'm using the 40 to 49 age band as an example, Your annual deductible is $750 per individual, $1,500 per family. What that means is for the first claim, for that calendar year, you'll see that $750 deductible being applied. If you have family coverage, we'll take out that $750 deductible from the first 2 persons within a family until we get that $1,500 deductible applied. I know sometimes the insureds might ask, okay, if I have a family of 4, does that mean that all 4 persons have to satisfy that deductible? The answer is no. We will only apply to the first 2 persons to submit claims within that calendar year. Moving along, we have the coinsurance factor, and you'll see that coming up from time to time within your benefit schedule. Now, the coinsurance factor is a percentage split of what Beacon will cover versus what your out-of-pockets would be. So, for example, if you look at the 40 to 49 category, your coinsurance factor is 75% on the first 50,000 per calendar year. Thereafter, we'll cover 100%. What that means is that Beacon will process all eligible claims. 75% of that will be our liability, and your out-of-pocket expense will be 25% up to the benefit limits on the plan. Now, for those of you who have pre-certifications, or maybe you have a planned surgery to do, and you're having this done within the managed care network, which is Caribbean and Colombia, the coinsurance factor is 80% on the first 50,000 per calendar year. And that is only for pre-certified procedures within the Caribbean and Colombia. Now, sometimes you might travel, whether it's on business or vacation, and you'd have an emergency, and you're required to check into accident and emergency because you need an emergency treatment undergone. Once you're within the Caribbean and Colombia, your coinsurance factor remains at 80% on the first 50,000 per calendar year. For pre-certification procedures that are outside of the managed care network, so everything outside of the Caribbean and Colombia, bear in mind that if you have planned surgeries, your coinsurance factor on those is 75% on the first 200,000. And I'll talk a bit more on pre-certifications as I go along the presentation. Another thing I'd like to highlight is your emergency treatments outside of the Caribbean and Colombia. Please bear in mind that any treatments outside of the managed care network will cover 30% of eligible expenses. Once you're within the Caribbean and Colombia, and you have treatment to undergo that has not been approved and not pre-certified, we'll cover 40% of eligible expenses. So as we move along the schedule, another thing I'd like to highlight is your pre-existing condition maximum. So I know there's an open enrollment period ongoing currently. This pre-existing condition maximum will be applicable to all the new enrollees coming on the plan. So what the pre-existing condition maximum speaks to is that anything deemed pre-existing, once you're a new enrollee on the plan, you'll be capped at a $750 limit for the next 24 months. Once that 24-month period has passed, you can submit your claims and we'll process in accordance to your benefit plan. For those of you who aren't aware what pre-existing is any condition that would have been that you would have had prior to your effective dates on the plan. So for example, if you come on 1st of May and you're a new enrollee and you go to the doctor and let's say they diagnose you with diabetes, that would be considered a pre-existing condition. So as we move along, your hospital daily room and board benefit, these are the limits on the screen here. What I'd like to make mention of is that this benefit is really applicable to semi-private rooms. And when I say semi-private rooms, what I mean are the rooms that has a partition or curtain separating the two beds. Now, if it is you check into a private hospital, and let's say you want a private room overlooking the ocean, just bear in mind that the majority of that out-of-pocket expense will be on your pockets, because you have certain benefit limits for the hospital daily room and board benefit. The intensive care units will cover at 2.5 times the average semi-private room rate, and this is in accordance to our UCR charges. Now, as I mentioned, the UCR, you'll see that coming up from time to time within your benefit schedule. What UCR means is that it's the usual, customary, reasonable charge. And it's really just a general threshold that we're governed by for certain surgical procedures. The whole concept of it is so that there's some kind of fairness when it comes to claims processing, because sometimes you might go to, let's say, Dr. Singh for an angiogram, and Dr. Singh might charge you $20,000, but then you might go to Dr. Ali, and Dr. Ali might charge you $50,000 for the same procedure. To ensure that when the claims come in, we're not reimbursing one person more than the other. That's where the general threshold comes into play, right? So under your surgical benefit, we'll process claims 75% of the UCR for those persons falling within the 40 to 49 division. Now, for those of you who are covered under the 50 and over plan, please take note that your surgical benefits will cover 65% of your UCR charges up to a max of $10,000. As we go along, I'll talk a bit about the miscellaneous hospital expenses. So this really speaks to things like cotton balls, gloves, gauze, needles. Those things don't really have an individual breakdown when you have to have surgical procedures done. So they're grouped together under the miscellaneous hospital expense. And we'll cover that in accordance to the co-insurance factor of your plan. Of course, those of you who fall within the 50 and over category, bear in mind that you are limited to 70% of UCR up to a max of $7,500. Now, if we go down a little bit, you'll see the prescription drug benefit. What I'd like to highlight here is that for prescription drugs, we'll cover 1 month at a time over a 90-day period, or we'll cover 3 months upfront. Sometimes you might go to the doctor and he recommends a 6-month supply of medication. In an instance like that, please do not purchase all 6 months upfront, because the contract is 3 months at a time. So if you get a 6-month prescription, what you could do is, for example, you go today and he gives you 3 months, you could purchase May, June, July upfront. At the end of July, you'll go back and purchase August, September, October, right? When you're sending in the claim form for that, you'll complete the front of the claim form, and to the back, you'll write repeat prescription, and you'll send in the remaining 3 months for us to process. So your diagnostic, X-ray, and lab benefit, this really covers things like your blood work, ultrasounds, any X-rays you have to do. But what is important to note here is that referrals are required in order for you to access this benefit. So within your plan, you do have doctor visits included within your plan, and the limits are there on the screen. What I'd like to mention here is that you're entitled to 1 doctor visit per day or 1 specialist visit per day. So sometimes you might go to a doctor and he diagnoses you with, let's say, COVID-19, but you may want a secondary opinion. You have to wait until the following day to get that secondary opinion. If you go to 2 doctors on the same day, we will only process 1 doctor visit in accordance to your plan limits. Specialist visits, you're entitled to 1 specialist visit per day, right? And for the specialist visits, bear in mind that a referral letter must be submitted with the claim form. The only exceptions that we have for specialist visits is ladies, your gynecologist visits. You actually don't need a referral for that. So you could go ahead and do your pap smears and your annual checkup without the referral letter. And for those of you that have kids on the plan that are 5 and under, we don't need a referral letter for the pediatricians. In the next row, you have the private duty nursing care benefit. Now, really nice benefit, but please bear in mind that this is really only applicable following hospitalization due to a serious illness or accident. And in order to access this benefit, your treating physician has to write a referral letter for you. Now, I don't know about Barbados, but in Trinidad, anytime you get released from the hospital and you need at-home care, usually your mom or your dad or aunt or maybe even a good friend will come and take care of you. With this benefit, that is actually not applicable for you to claim under. In order for this benefit to be eligible, the person that is conducting your private duty nursing care must be a registered nurse. You also have a physiotherapy benefit that's built into your plan. And of course, a physiotherapist falls within your specialist spectrum, and we do need a referral letter once you're accessing that benefit. As we move along, you'll see preventative care as well. So this is a benefit that I really like, more so because it's not subject to the deductible or co-insurance factor, which means that you can get back up to 100% on this benefit. Now, for those of you who are going to do your annual medicals and your preventative care, once you have to submit claims for this, the diagnosis on the claim form must state annual medical or preventative care in order for us to process under this benefit. Any other diagnosis will be processed under other benefits within the plan. As we move along, there's also a local ground ambulance benefit. And what I want to stress on here is that this ground ambulance benefit will take you from point A to the hospital. Once you're discharged, it's assumed that you're stable and you can find your way back home. The whole point of me stressing on this is because a few years ago, we did have a case where a lady saw that she had this benefit applicable to her. She called the ambulance to take her to the hospital. When she was discharged, she called the ambulance to drop her back home. And then a week later, she had further blood work to do, and she called the ambulance to take her from her house to the hospital. When the claim came in, we only covered 1 ambulance charge, which was to take her from point E to the hospital, which was the very initial stage, right? So bear in mind, it will only cover you from point A to the hospital. So as we move along, there's a medical air transport benefit. Really nice benefit, but bear in mind, in order for this to be eligible for you to use, approval must be given by Beacon. So before you access it, because maybe you don't have the drugs locally or your procedure can't be conducted locally, you need to send in written requests to our team alongside your referrals and other supporting documents for the team to review and give approval prior to you flying out of the country to utilize this benefit. Now, your emergency doctor's visit. This benefit in particular speaks to anything that is emergency related. And when I speak to that, I mean, you're at risk of losing your life or your limb, that is really what emergencies are about. So sometimes you might be walking and you fall and you think, oh gosh, I'm getting a bruise, so I need to be rushed to accident and emergency. That is actually not an emergency. So only in dire situations will this benefit come up to play. Of course, with any schedule of benefits, there's an internal lifetime plan limits that we have listed, and these are actually not subject to the deductible and coinsurance factors. So we'll cover things like organ transplants, AIDS and any age-related illnesses, and of course your congenital birth defects benefit. Now, what I'd like to highlight about the congenital birth defects benefit, it's really important to get any newborns on the plan within the 31 days after birth. The whole point of it is because sometimes kids are born with holes in their hearts, for example, and it isn't recognized until later on in life. And then you don't want to find yourself scampering to get health insurance and put the child on, because then it's going to raise a flag as to why it is the kid is now being added, and further medicals will have to be done. So to avoid all that, once you add baby on, and something comes up, you'll have access to the congenital birth defects benefit. Now, two benefits that we all seem to use a lot, which is your vision and dental benefit. Now, for both benefits, what I want to stress on here is that you're going to see deductibles coming into play again. What I want to mention is that these deductibles are separate and apart from your major medical deductible. So even though you would have satisfied the $750 deductible for the calendar year, if this is your first time going to get your eyes checked or your teeth clean, bear in mind you're going to see that deductible coming out. So I'll drill down a bit on the vision benefits. Now, both divisions have a maximum benefit of $500. So what that means is that once you go in to do your eye exam, your lenses, your frames, you're entitled to a maximum benefit of $500. What I want to highlight here is that eye exam and lenses are payable once every 12 consecutive months. So if you go the 1st of May, 2025, you have to wait that 12 consecutive months before you send in another claim. So that will take you till the 2nd of May, 2026. If you can't remember when last you went to test your eye and get your lenses, please reach out to your plan administrator or your broker for them to confirm the date for you. Because if you go before the 12 consecutive months and you send the claim in, it's going to be denied because you didn't satisfy the waiting period. Likewise, if you have to change your frames and you go the 1st of May, please bear in mind that frames are payable once every 24 consecutive months. So if you go the 1st of May, you're going to have to wait till the 2nd of May, 2027 in order to submit your claim for frames again. Of course, if you can't remember the date, please reach out to your broker so that they can confirm when last you claimed under your vision benefit. Another thing I'd like to highlight is that for persons who purchase glasses and lenses online, we will process those claims. What you have to do is when the claim form is coming in, submit a copy of your prescription along with the invoice showing the breakdown of costs for your lenses and your frames. And we also need proof of payment. So if you're using your credit card or your PayPal account, where it has a line item on the statement showing that the charges were applied, we need to see a snippet of that when the claim is being sent in. Now, moving on to the dental benefit, there's a maximum amount per calendar year for both divisions, which is $650. And of course, that will cover things like your cleaning, root canal, fillings, any dental work that you'll have to do. Bear in mind, if you go, let's say the 10th of May, and you maximize or you use that full 650, you will have to wait until the following calendar year for that benefit to be replenished, right? So you'll have to hold off until the 1st of Jan next year for this benefit to be replenished. Right? So I'm just going to speak to a little bit about the service offering, more so because the team hand selected these 4 key service attributes to really help manage the day-to-day operations of the BARP plan. Under the dedicated client relations pillar, there is a client relations team that is attached to the BARP's portfolio to really ensure some kind of quality control and service delivery. Outside of that, you are assigned a senior account manager who is Alicia Collymore, and she's on the call too. And she's really there to support the plan administrator as well as your broker with any key escalations and queries that the BARP's plan may have. A feature under this pillar is the on-site help desk service. So we do have representatives that are stationed at the BARP's office to help any insureds or members through the enrollment process if they have any queries on claims, any escalations where premiums or administrative queries are concerned, they could visit that office. And of course, the broker is also there to support you as well, right? Similar to this session, which is an employee awareness session, your senior account manager from time to time will liaise with your plan administrator and your broker to see if there's need to have any continuous refreshers along the policy year of the contract. So under our technology pillar in Beacon, we do have a system-based web portal that is really there to help your broker with the administration of claims and enrollment forms. So they do have access to an online portal where they could upload claim forms and enrollment forms. And once they upload it, it hits our system instantly for processing. They can also view and track the status of claims processing within 24 hours. And even download the EOBs for the insureds for anything that is pending or even claims that have been paid, so that they can determine the reimbursement amount too. Going hand in hand with the portal, we do have a quicker turnaround time for claim settlement, and that is 7 to 10 working days. Of course, if there's ACH set up in the background, claims are paid a lot quicker because once we've processed on our end, it goes straight to your bank account. Now, I would have talked about overseas care at the start of the presentation. But for anything outside of the Caribbean and Colombia, we do have an overseas case manager that really focuses on patient advocacy and cost control management. What that means in a nutshell is that should you encounter any problems while you're outside of the managed care network, which is the Caribbean and Colombia, our third-party coordinator is going to get involved to really monitor the insured's health status, do a full evaluation and auditing of hospital invoices and bills to really ensure that the services that are rendered at the hospital is what is being charged for. Because we've been in the industry for quite some time, we're able to form long-standing relationships that really help us to negotiate discounts at times if necessary. And just some frequently asked questions. So who is eligible for coverage? Well, of course, you, the member, as well as your spouse, and your spouse can be legally married or common law. Your dependent children are also applicable, and dependent children could be naturally born, legally adopted, stepchildren, and even incapacitated kids. Now, for coordination of benefits, for those of you that are covered by more than one plan, coordination of benefits can come into play. What is going to happen is if you are covered by BARP's plan at Beacon and you're covered by another plan, let's say at Sagicor, if BARP's plan is your primary plan, we will process the claim under Beacon in the first instance, and then the remaining amount will be processed under Sagicor. What I want to highlight, and I confirmed with the team today, is that for COB, the insured has to submit the claim for secondary processing at the secondary insurer. So once we're finished processing on our end, the claim form must be submitted by the insured to be processed by the secondary insurer, right? Just wanted to clarify that because I think in the session last night that was a concern. Now, for emergency situations while on vacation or business, we would have talked about this. We do have an overseas coordinator called Global Excel Management. You are going to have the contact number at the back of the medical card once cards are issued, right? As I mentioned, the cards, what I'd like to stress, the cards are not attached to a network card. It's a reimbursement type plan that you have. So once you go for medical services locally, you'll have to pay the full amount upfront, submit the claim form, and then we will reimburse what is owed to you. Right? So just something to keep in mind where the card is concerned. So for claim submissions, and I'll spend a bit of time on this. One thing I'd like to highlight here is that all claims need to be submitted to us within 90 days from the date of service. So if you go today, you have 90 days from today's date in which the claim has to be sent in to us. Now, if on the 96th day, you realize, oh shoot, I forgot to send in the claim, please bear in mind that if you send it in and we review, the claim is going to be denied as time barred because the 90-day submission time period would have gone. For those of you who sent in the claims within 90 days, once we review, you'll get an explanation of benefit statement showing you how the claim was processed and whether you have any reimbursement amount attached to it. Now, sometimes claims may be submitted and we don't have all the information on file to process the claim. What is going to happen in an instance like that? The EOB will be sent to your email address with a note stating exactly what is missing. So for example, if you sent in the claim form and the receipt is missing, we're going to process the claim pending your receipt or pending proof of payment. Once you get that EOB where we're requesting additional information, please note that you have 45 working days in which that information must be submitted to us for review. So I'm just going to go through a checklist for submitting claims. I know this is probably tiny on your end, but it's the front page of a claim form. Now, all claim forms, whether it's Beacon, Sagicor, Guardian, are more or less the same. The only difference is the logo. So if at any point you go to a provider and they don't have a Beacon claim form, but they have a Sagicor Guardian claim form and you utilize that, just scratch the logo before you send it into us for review. So at the top of the claim form by section 1, you have surname, first name, date of birth. Now we all know the insured's name will go there together with their date of birth. If the insured is the patient, next to patient's name, you could put same as above, and will your relationship field and your date of birth field will remain blank. If the patient is a spouse or even a child, the dependent spouse or child's name will go by patient name. The relationship type, whether spouse, son, daughter, will be stated next to relationship. And of course, their date of birth will come after. For those of you who have coordination of benefits, the box right under there, you'll populate that with the other insurer's name, so that when the claim form comes in, we'll take note of that, right? Your authorization section now. So if the insured goes to get medical care, the insured signature and date must be stated in the authorization section. Where the insured is a spouse, or sorry, where the patient is a spouse, the spouse must sign next to spouse's signature, but we also need the insured signature on the authorization section together with the date, right? So for those of you who are going to get your eyes checked, so eye exam, lenses, frames, the optometrist will usually fill out section 3. So they will state the diagnosis, the date of service, the description, and your charges. Most times, they don't include the patient's name and the date of birth. So if it is you realize that it's not included, before you send in the claim form for us to review, you could write it in yourself and then submit to the brokers for sending in to us. Now, if you flip to the back, when you go to your doctor visits, your specialists, even if you have hospital visits to do, they will fill out section 4 of the claim form, which is the back. The date of service and the diagnosis must be clearly stated on the claim form, and of course your costs and any further services rendered. Most times, they don't put the patient name and the date of birth to the top right-hand corner of the screen. So if you realize that it's not included, please write it in before sending in the claim to us. If we get the claim and it's missing, the claim is going to be pended for that information. As we go down to the bottom of the form now by section 5, that is really for your dental visits. Same thing for section 5, the patient's name and date of birth must be clearly stated to the top right-hand corner of section 5. The dentist is going to fill out the date of service and any other services rendered while you're there. Now, if you have any particular work being done on one tooth, the tooth number or the letter must be stated within the box under section 5. If it is the dentist doesn't state it there and they want to shade the tooth on the diagram, we'll accept that as well, right? And of course, they will stamp, sign, and date. Right, and I'll just talk a bit about pre-certifications. So any planned surgeries should be pre-certified prior to you going for the surgery. The whole process takes about 48 hours. So once you know you have a planned procedure to do, you could send the breakdown of the cost into us for review so that we could advise what we will cover versus what your out-of-pocket expense would be. Right? So anything planned must be pre-certified prior to you accessing the procedure. Right? So I've come to the end of my presentation. I'm going to stop sharing my screen and I'll open the floor to any questions, anything that you want me to go over. You could feel free to ask. No questions?
Remember, if you have any questions, you can use the raised hand reaction feature, or you can pose your questions in the chat. Monique, there's a question in the chat. If I end up having emergency surgery overseas, I have to pay the entire bill, then wait to be reimbursed?
So if you have it within the managed care network, which is the Caribbean and Colombia, we've partnered with a provider within that region to kind of help manage any emergency claims. Of course, if you're in a situation like that, you should contact your broker so that we're made aware of, so that we could kickstart the claims process there. If it's outside of the Caribbean and Colombia, that's where our overseas case manager is going to come in. So that's where Global Excel Management will come in. So for emergency situations outside of the Caribbean and Colombia, the insured should contact the number to the back of the card so that they could start the end-to-end claims process. Right. I think Adrian was asking if there's an electronic presentation for us. So Adrian, I believe this will be shared on your on the BARP's webpage. So you could access it there. Also, the presentation and the benefit schedule will be sent to the broker later on as well. Oh, thanks, Alicia. Just saw your comment.
Also, I can add here is that they are welcome to join us again at 6:30 for those who visited late or who came onto the presentation late. We have another session at 6:30.
Thank you. So I'm seeing Jan Jones is asking, I enrolled at the end of April. When do monthly payments begin? So Jan Jones, you could visit Lynch or the BARP office to make your payments because the plan is effected from 1st of May. And Doreen asked, is a colonoscopy considered a procedure that needs pre-approval? Doreen, you should send in a breakdown for your colonoscopy prior to you going. Bear in mind, when you're sending it, we do need a diagnosis on the invoice, and your name must also be stated there as well. I know sometimes we might be shy to ask questions here, but if anything comes up outside of this call, or maybe over the next few days, you do have your brokers as well as the BARP team on standby to clarify any concerns or any questions that you may have. So they're there to support as well. So I'm seeing Mel asking a diagnosis before the colonoscopy. I thought you go for a colonoscopy for a diagnosis. Mel, in order for you to get a colonoscopy done, the doctor must be trying to rule out some kind of diagnosis. So that's where the diagnosis that they're trying to rule out will come into effect prior to you getting the colonoscopy. I think Balance. I hope I have your name correct.
Mr. Gooden, you've been asked to unmute. Once you unmute, you can go ahead and pose your question.
Yes, I noticed that when it comes to the coverage per year for the different age groups, like the 65 and over, which is 150,000 per year. But the question is that for the life of the plan, which means that you only have, you can only claim up to $150,000 for the rest of your life? Is that what it is?
No. So I think you were asking on the 60 to 65 category.
Correct.
So the 60 to 65 category has a lifetime maximum of 500,000. Per
Okay.
year, however, yes, you're capped at 125,000, but the lifetime maximum is 500,000.
Right. But you're capped for 125 per year. That's what you're saying.
Correct. Correct.
Okay. Gotcha. Okay, thank you.
You're welcome. Okay, so Cecilia, I'll hand over to you to close because I don't think we have any other questions left.
Okay, thank you, Monique. Let me say, as usual, it was a very educational seminar, and I'm sure that our members leave with a little bit more knowledge and understanding of the plan. So I want to express our thank you to the Lynch team and also to Beacon for their time, the time that they took to execute this educational seminar to us. So once again, thank you very much, and you enjoy the rest of your day.